Today we are going to talk about investigations of Chiari malformation. In this video we will see which investigation is best for the diagnosis and how can we diagnose Chiari malformation in the fetal life. We will also discuss the investigations performed to prepare a patient for surgery. First of all, we perform X-ray cervicovertebral joint plus cervical spine AP and lateral view. As a patient comes with headache, neck pain and other symptoms we discussed in the last video, so we have to make a differential diagnosis and we have to rule out the different causes of symptoms of patient. Number 2, there is investigation of choice or investigation for the exact diagnosis of Chiari malformation, and it is upright or standing MRI of cervicovertebral joint plus entire spinal cord. Normal MRI is done in the spine position or lying down position, but in Chiari malformation we perform upright MRI because we have to see the effect of gravity on the cerebellar tonsils and other structures. If we perform MRI of a Chiari malformation patient in the spine position, we will not be able to assess the descent of cerebellar tonsils and other structures. T2 weighted sagittal MRI is advised. We assess the anatomy of whole spinal cord and other structures like brainstem, cerebellum and the ventricles in the brain. MRI also gives us the details of syrinx if any is present in the spine. So it is a justification for advising MRI. Remember that this MRI will be upright or standing and we will perform MRI of CVJ plus entire spinal cord. If we diagnose the patient as Chiari malformation on the MRI, we have to move for the further plans. We have to see the bony stability and for that we advise CT scan. CT scan gives us the details of foramen magnum, a bony hole in the base of the skull and bony anatomy of the posterior fossa to plan surgery. Because the bony anatomy and bone stability, cervicovertebral joint stability is most important before we plan a surgery. The next investigation if we are planning a surgery is Cine MRI for CSF flow. If we talk more specifically, it is cardiac gated phase contrast Cine MRI and it is called PCMR. So we have to justify why we are advising this investigation. The answer is we have to see the flow dynamics. We have to see the CSF flow, CSF pressure, peak flow velocities and pressure gradients in the spinal cord. Remember this MRI is cardiac gated, so we have to see the duration of flow during systole and diastole. We assess the flow of CSF in the different ventricles and the spinal cord. We have to assess the pressure. So these were the investigation when a patient was coming with symptoms. Now we have to diagnose a fetus with Chiari malformation. We perform anomaly scan around 22-23 weeks of gestation, and in this ultrasound we see banana sign or banana cerebellum. This is named banana sign because the cerebellum looks like banana and it is wrapped around the brainstem and compressing the brainstem structures. We can appreciate the descent of spinal cord and abnormal configuration in the ultrasound. This ultrasonography is vital in diagnosing the fetus with Chiari malformation because if there is a banana sign, we counsel the patients, we tell them about the condition of the fetus and possible outcome of the disease after birth. Banana sign is seen in Chiari malformation type 2. So this was all about investigations of Chiari malformation. Thank you.